It's now time for our weekly COVID-19 data report. That data report is going to be presented by Brian Gottschall. He is our director of the Berks County Department of Emergency Services. Brian Gottschall.
Good morning, Commissioners. Thank you very much. Yes, September 30th, our weekly data report. Starting out with our testing and case slide. You'll take note kind of on the right-hand side of the screen there, we see that little up and down blip. The last time we looked at this a week ago, we were in the middle of that up and down blip and hoped that that portended the beginning of a downward trend. Unfortunately, it did not. We are still looking at a rising case count over our smooth 14-day period. The good news that it's rising at a much less steep rate than it had been prior to that blip. So I'm sure that folks have seen in the media that there's a lot of reporting about how much of the nation is over the Delta surge and is on kind of the backside of the curve. While that is not the case in Berks County or in Pennsylvania as a whole, we hope that we will soon be following suit behind those states that saw the early Delta surge much sooner than Pennsylvania did, and that we will begin tracking downward again soon also. Good news front, as we've said over the last couple reports, is that our our testing numbers are also very high, which makes us feel pretty confident that our case count rates are accurate and that we're not overlooking a large amount of COVID in the community. Again, case testing and case count go hand in hand to positivity, and we are still seeing very high positivity numbers above the 20% when we're looking at both our confirmed as well as suspected cases, taking into account rapid antigen testing. We have a disproportionately high number of cases in Berks County that are diagnosed with rapid antigen testing. One would imagine that that's due to our very robust healthcare system and the fact that that testing is out there and available in the community, whereas it is not the case in many counties throughout the Commonwealth. Our hospital numbers are up still week over week. Again, looking at both confirmed as well as suspected cases in-house, we are still seeing that great publication of information regarding vaccinated versus unvaccinated in St. Joe's, still asking our partners at Reading to deliver their information in that way to help the community to understand the impact of vaccination in avoiding significant illness, including that would result in ICU admission and ventilator need. Our deaths continue to be that lagging indicator behind our cases. When you look at our death curve along with our case curve, we do see them tracking very much with a visually similar presentation, and we're very anxious to see us get over that death hump, but unfortunately that comes behind our case count hump, which, as we illustrated, we're still on an upward rise in. Not a whole lot to say about vaccinations this week. Our numbers are very static, both in the raw numbers as well as the per capita numbers when compared with other counties in the state. We continue to see small increases week over week in trying to achieve our percent of the population over the 18 is vaccinated. Pennsylvania is now very close to its 70% goal. Berks County trails a little bit behind, but continues to close in on that number week over week. When we look at our numbers for those who have already received their first dose, we continue to still see a very large percentage of people in Berks County who appear to be long-term one-dosers that are not going to go and finish their numbers. And when we correct for that statistical anomaly, we see that even with those at least first dosers, we have not yet reached our 70% goal of those over 18. Continued good news in that since May 26th, we lead Pennsylvania as far as growth of vaccinated individuals in all categories except that of the 12 to 18 year group. Some changes to our vaccine strategy updates. As we've been talking about for the last couple weeks, folks who are immunocompromised are encouraged to secure a third dose of vaccine if they're 4 weeks out from their second dose of either Pfizer or Moderna, either of the messenger RNA vaccines. New this week is now that Pfizer-only recipients who are 6 months out from their second dose and fall into the category of either being 65 or older or 18 to 64 with high at risk due to underlying medical conditions or work or living settings are now encouraged to seek a third dose, a booster dose of that vaccine. This does not yet apply to Moderna recipients. It also does not apply to the Janssen J&J vaccine. This leads us to the question of, well, what does high risk mean? And I would encourage people to go to, I'm going to do this slide backwards, I apologize. I would encourage people to go to CDC and look at the information for themselves. We provided the link down here in the slide, but it's a very complicated link, and the very easy way to do this is just to do a web search in your favorite browser for CDC COVID booster, and that'll get you to the CDC page that talks about this. But generally, high risk is those who are working in the fields that are defined here on the slide, or who are living in these conditions that are defined here in the slide. The underlying medical conditions category is much too complicated to deliver in this way in a single PowerPoint slide. So for that, we definitely do encourage people to go to the CDC website and take a look at what that entails. Again, as always, doyourpartberks.com, www.doyourpartberks.com. Great resource to find locations within Berks County where you can seek vaccine, either because you're a late adopter and are just starting the series now, or because you fall into one of those categories for either an extended third dose or a booster dose. With that, Commissioners, back to you unless there are any questions.
Yes, Brian, can you go back to the slide regarding the booster and the third dose?
Yep. This one or the first one, Commissioner?
The next one. It should be the next one.
Yep.
Okay. So could you explain why there's a 4-week for immunocompromised and there's 6 months for the second dose? Is there a justifiable reason for that? Or again, from my standpoint, it gets a little confusing.
Absolutely. And I think that this yes, I can explain that, and I think it drives back to what I've been encouraging over the last number of weeks. We commonly refer to this third dose for the immunocompromised as a booster, and we've kind of been talking about it society-wide in an erroneous way in saying that, the first booster doses were approved for the immunocompromised people, and now we have the second package of booster doses approved for those at the bottom of the slide. That's technically not correct. The third dose for the immunocompromised folks is not a booster dose. In actuality, what the FDA and the CDC have said is that a normal vaccine administration for the immunocompromised is now a 3-dose vaccination, much like it's a 2-dose vaccination for the normal population. So in essence, you'll recall that when you got your second dose of your messenger RNA vaccine, it was 3 or 4 weeks, depending on the type of vaccine, after the first dose. That's the reason that there's a now 4-week spread after your second dose to your third dose, because it is not a booster. It is actually a third dose in the normal series necessary to generate the immune response in those who are immunocompromised. Compare that to the bottom part of the slide. This is actually the first availability of real booster doses for any segment of the population, and why it is spread out a longer period of time.